Adjusting to parenthood after delivery is challenging under normal circumstances, let alone in the midst of a global pandemic. Welcome to this edition of House Call. I'm Jessica Salazar, the Director of Marketing and Public Relations with Overland Park Regional Medical Center, a part of HCA Midwest Health. Today we're talking with Dr. Sarah Tulkin, OBGYN with specialists in women's care, about managing postpartum depression and anxiety during COVID-19. Welcome, Dr. Tulkin.
Hello.
Hello. It looks like you're joining us from one of our labor and delivery rooms. So you're delivering babies today.
That I am. It never stops.
It never stops. That's good. Now, Dr. Tulkin, social distancing recommendations and a lack of social support that women typically use to build resilience and promote recovery can be challenging for new moms during this time. Do women who deliver during COVID-19 have amplified risk factors for postpartum depression?
Unfortunately, for 1 in 5 new moms, those baby blues that come right after delivery, they don't go away. This is normally considered postpartum depression and can appear anywhere from pretty soon after birth, like 4 weeks, to any time during that first year after birth. Many women with postpartum depression are anxious with this COVID-19, and how are they going to manage this at home with a new infant and possibly other kiddos? While distancing recommendations are important to control the spread of the virus, this also limits one of our best resources for helping women deal with postpartum depression and postpartum anxiety. Social interaction is key and really helpful for these women. So not only is it more difficult for them to receive support under the social distancing recommendations, but living in close quarters with kids and partners and parents and whoever else is there to help them can also increase conflict and interfere with adapting to this new life with this new baby.
Mm-hmm. What are some symptoms of postpartum depression?
So symptoms of postpartum depression can vary from anywhere to mild to severe. Sometimes they can be as simple as one symptom, or there can be multiple. Women who are experiencing postpartum depression symptoms typically have symptoms such as nervousness, anxiety, panic, restlessness. They can feel sluggish, they can feel tired, they can feel exhausted, sadness, hopelessness. Their eating and their sleeping is not normal. It's hard to concentrate, they are confused, they're over concerned for their baby, or sometimes there's even a lack of interest in bonding with their baby. There's, of course, those feelings of guilt, inadequacy, worthlessness, that you're not doing a good job as a mom or a parent. And of course, there can be really high highs and really low lows. And the worst symptom, in my opinion, would be the thought of harming yourself or harming your baby. A lot of these do sound like normal symptoms that just come from having a newborn at home. So if you ever have any questions about what's normal and what's not, that's our job as your physician to help you kind of figure out and go through.
Mm-hmm. What should a new mom do if she thinks she has postpartum depression or anxiety?
The most important thing to remember is that you're not alone. You're not the only person that this has happened to. While these symptoms and feelings sometimes will go away within the first couple weeks of pregnant or delivery, a lot of times they don't. And if they don't go away or you feel like you need medical attention, please contact your medical provider. There's medications, there's therapies, or we can use both of them to help you be the best parent that you can be. Just make sure that you let us know, because we're here to help you. We're part of your healthcare team, and we can provide you with excellent resources to help you get better.
That's a very important conversation you need to have at your follow-up appointment with your OBGYN.
Yes.
Absolutely.
And we've recommended seeing our postpartum patients now at 2 weeks postpartum, in addition to 6 weeks postpartum, just to kind of do a mental checkup on our patients, especially in this really isolating time.
Why is prioritizing self-care so important for new moms, especially during COVID-19?
So your home life can be constant chaos with a newborn. A regular routine, regular is kind of a funny term when you have a newborn at home, but focusing on self-care with the nutrition, exercise, sleep, and taking time for yourself and your support system is key. This can begin with something as simple as taking a shower, or putting on real clothes and not just sweats or pajamas, and opening up the windows and maybe just sitting outside. Those are all what seem very normal activities, but when you've got a new kiddo at home, those can seem like big obstacles. So taking the time to make those small adjustments in your day can really help with your mental well-being.
And that sounds like great advice too for just any mom at home.
Yeah.
Self-isolating with
Try
their
and be
family.
normal.
Yeah, try and be normal. Exactly.
Exactly.
Now, Dr. Tolkien, you have some tips for new moms to help fight postpartum depression and anxiety during COVID-19. I think number one, ask for help. You want them to ask for help.
Of course. You are not supposed to do this by yourself. If you have a spouse or a parent or both who are there helping you take care of this child, ask them for help. If you've got other kids at home, you can ask them to do age-appropriate chores like picking up their toys, folding the laundry, washing bottles, or feeding the baby, just so that you have an opportunity to go to the bathroom, because things like that are hard when you've got a newborn at home. You don't have to do everything.
Yes.
It's also really important to make sure that you take time to eat and drink, especially because you just had a baby. Whether you had a C-section or a vaginal delivery, you've got to heal from that. And so proper nutrition is important for healing. And if you're breastfeeding, it's also incredibly important to make sure that you stay hydrated so that you can provide the proper milk for your baby. Make sure that you take time for exercise or just something that you enjoy doing. Make time for those things that are enjoyable. If you can, get outside. Being outside, getting the sun is really helpful for both you and your baby. If you've got a stroller, going for a walk is wonderful, or you can do baby wearing and just go for a walk that way. Try and get some sleep. I know that's easier said than done, especially when you have a newborn at home, but enlist the help of your spouse, parents, other kiddos to help with nighttime feeds or diaper changes or something like that. And I know everyone recommends sleeping when the baby sleeps. And while that's easier said than done, if you can get a quick 15-minute nap, that can go a long way. Try to relax, take deep breaths. You're going to get through this. Each day gets better. I can speak from experience with that. The day-to-day can be very overwhelming, but when you look back on the weeks and the months, it goes so fast. So try to enjoy the time that you have with your newborn, because it goes so quick, and then they grow up and they're walking, and it's a whole different experience. And there's lots of good online support systems and online blogs and things like that you can talk with other moms or just talk with your family, your friends, and other people who have newborns or little kids at home. Those are some of our excellent resources that they can kind of bounce things off with and say, this is normal. Oh, I would do this, or this is what works for me. So sometimes those closest with us are our most helpful with coping with things like this.
And we are currently offering online breastfeeding support groups. So that's another tool that new moms can use in order just to connect with other moms. And we'll link to the registration to our online breastfeeding support group in the post. That way, any new mom can join the group. It's free. You do not have to deliver at Overland Park Regional Medical Center to join the group. So it's just another great resource to connect with new moms and talk about feelings or how you're feeling during this time.
Yeah.
Thank you, Dr. Tolkien, for joining us today. Remember, these tips do not replace care from a healthcare provider or mental health professional. If you feel like you have postpartum depression or anxiety, please reach out to your OBGYN or primary care provider. You can find an OBGYN or midwife at oprmc.com/unique delivery.